So I'm a mom of two girls. They're 8 and 10 years old. And when I attend all the requisite social events like birthday parties and soccer practices, people will often ask, what do you do for work? And when I tell them I'm a pediatric ICU nurse and I've been doing this for 13 years, I can feel the shift that happens from the everyday casual to a much more weighty space. And I can understand the somewhat awkward pause that often follows because we've suddenly touched on something very tender with the idea of children being critically ill and dying in an ICU. Because kids, right? Kids, they're just getting started. They're just getting started, and yet, as amazing and as almost magical as children can seem, they're just as human as any of us, which means that they are just as susceptible to serious illness and death as any other human. And so you might be thinking what a lot of people end up saying to me, which is, I don't know how you do your job. So I want to share with you how I've learned to do my job, and it's not by way of compartmentalization, which I think we're traditionally taught, but I've learned another way. And I'm going to share my journey with you by way of 3 patient stories. The first 2 patients being my pediatric patients, and then the final patient being me. But before we go into the first patient story, first a brief backdrop on me as a young nurse and a young mom. When I was in nursing school, I thought for sure I would work with adults. I came out of a background of doing years of research with the frail elderly. So we did exercise, toileting, and feeding interventions, and I didn't have kids of my own yet, and I was quite frankly very awkward with other people's kids. And so I was a rather pleasant surprise to find that I fit more naturally than I would have expected into the rather prescribed role of a pediatric nurse. And I liked the idea of being a healer and a superhero of sorts to my patients and their caregivers. And so I went into it all rather starry-eyed, and in any case, in the beginning, there's so much to learn by way of skills and science and technology of ICU nursing. So I'm trying to take it in, and on top of that, 2 years into being a new nurse, I had my first child, and then 2 years after her, our second child was born. And if I thought being a new nurse was scary, being a new mom was terrifying. Because there's no prescribed role to being a parent, right? I just had to learn who I was growing into as a mom and learn who my children were growing into, what our relationship and our values were going to look like as we faced life's struggles and challenges together. So those first 4 years of nursing and parenthood, I just was in the weeds and trying to take it all in. And finally, at the 4-year mark, the dust starts to settle. And I feel a whole new space start to open up inside of me to process my patients' stories in a way that hadn't been there before. And I was not ready for that space to open up. So I came on shift, and my patient was about the age of my younger child, and she was dying of a serious infection. And so the parents had decided at this point that they wanted to go ahead and withdraw all the life support. And my job that day was then to walk them through what it would look like to remove the breathing tube and to stop all the medications that had been keeping their child alive. The parents couldn't bear to be in the room when we did all of this, but the mom did want to come back afterwards to help with a bath. And so as they stepped out, the mom looked at me and she said, "Please be gentle with my child." And I looked her in the eye and I said, "I promise you I will be gentle." So they stepped out and we disconnected everything, and her child died within about 5 minutes. And then we cleaned up the room and we brought the mom back. And at this point now we're standing on opposite sides of the bed from each other and we're bathing her child. And the mom starts to sing this song. And it's not in English, so I don't understand the words, but it's just this lilting, haunting melody. And the mom would sing, and then her voice would catch. And then she would start singing again, and her voice would catch. And I just knew that this must have been a song that she had sung to her child countless nights at bedtime. After the bath was done, she changed her child into pajamas from home, and then kissed her child goodnight one final time. I went home from that shift and I kissed my kids goodnight, and I was absolutely wrecked. Because what I had learned up to this point was In order to do my job, I needed to compartmentalize. Just leave work at work. Think of the hospital as where all the abnormal, sad, sick cases are sort of tucked away. And when you clock out, just leave your patients behind. Go home and enjoy your normal, healthy life. Just leave work at work. But I realized on this shift that the things that I bear witness to, the stories that I'm a part of in the hospital, they're too human. And I'm too human to just leave work at work. Right? The things that I do, who I am inside the hospital, are just as real and just as true to all of our lives as who I am and what I do outside of the hospital. And so I realized what I was going to need to learn how to do was not compartmentalize, but integrate all of my experiences into all of who I am. And as I started to learn how to integrate all of my experiences, there came a curious relief and freedom with this integration, because I no longer had to pretend that I didn't grieve for my patients. I didn't have to pretend anymore. I could just grieve. And I could then get in closer and actually learn more about who they were, who their families were. And I could start to provide a kind of care that I think I had always wanted to provide, but was perhaps a little too scared to get close enough to learn how. And so now fast forward about 7 years, and my patient is a child whose chronic illness has progressed to the point where the child is no longer responsive to or interactive with the outside world or her parents. And so the parents are at a crossroads. Do we continue to pursue much more aggressive life-prolonging measures, or do we start to peel away a lot of these treatments that we've been trying with the understanding that our child will likely die? And because I had now learned at this point how to move past just the clinical, well, this is how the science is going to look one way versus the science another way, I was able to start asking different questions and get closer and find out who they really were and what mattered to them. And so I learned that what they really wanted for their child was just that she not suffer unnecessarily and that she have quality of life more than anything. And so together in our conversations with the medical team, we were then able to come up with a very individualized end-of-life care plan that helped the parents to feel that they were very much still taking care of their child and not just giving up on her, even as they were saying goodbye. And so I spent the last few days of this child's life with her and her parents, and even in the midst of the very, very real grief. On the day that the child died, it was so beautiful to hear the mom say, "I am so lucky to have experienced what it is to be a mom. I'm so lucky." See, death and dying in children will never feel right. It won't. It will never feel right. But bringing our full humanity to them and to the ones who love them, this will always feel right because it helps us all stay true to who we are to the very end. Still, in all of this, there remained one final barrier between me and my patients, and that was simply that I was still the healthy one. I could still clock out and go home and enjoy my healthy life, and that was true until this past year, when in January I got the phone call that the results of a biopsy of a lump in my right breast were in fact positive for cancer. And so I understood, I think for the very first time, really what it feels like to have your entire world turned upside down in a moment by serious illness. So I went through treatment through the first half of the year, and by June was declared to be in remission. And then I entered into long-term preventative hormone therapy. And then our family started to settle into our summer plans when, at the end of July, my husband suffered a very random infection that reached his spinal column, and it led to such intense swelling that he suffered a severe spinal cord injury. And so he was whisked off to emergent surgery, at this point barely able to use his arms or legs, and we weren't sure coming out of surgery just how much function he would regain, if any. So then he spent a month in an acute rehab facility, and after that came home to continue rehabilitation at home with me as his primary caregiver. And I am incredibly, incredibly grateful to say that even with some deficits still on board, he was able to return to work just last week. There were obviously a lot of things about this past year that shocked me. But one of the things that surprised me the most was how much pressure I felt in just the ethos of our culture and in my own heart to perform endless stability and endless optimism and endless clear-mindedness. And just this sense that I wanted to be a superhero patient and a superhero caregiver. And there was just a voice in my head that said, don't be too sad, and don't be too angry, and don't be too needy. And the people who I found the most comfort in were the ones who didn't show up to me with a performance of their own, and who let me then bring to the surface my real questions, my real fears, my real sorrows. And these are the people who helped me find who I was and where I really was in the midst of all of the chaos. It may surprise you to hear that I still worked through the bulk of this past year, and it was by choice. But I really wasn't sure how it was going to go. But it's been incredible to me now to find that when I walk into a patient room, I'm somehow no longer so intimidated by the emotional complexity of it all, both for them and their caregivers, but also for me and how I experience their story. I have so much more openness to letting them show me where they are in the whole messy mix, and letting me see where I am in that, and I can just meet them, and then we can find the next step together. And so my hope for all of us is that we can all begin to move past compartmentalization, particularly when it's dictated by a fear of other people's experiences. That we can open ourselves up to the full range of human experience, and in this find a whole different way to carry each other and to be carried. Because this is where we find a freedom from that pressure to perform, and a freedom from the isolation and the loneliness that that performance pressure brings. And I can tell you, my friends, as someone who has been in deep in all of it, that this is not only how I've learned to do my job, but I've learned that this is truly the most freeing and the most beautiful way for us to be. Thank you so much.